Reason for flossing. The bristles of the toothbrush cannot reach the adjacent tooth surfaces between the teeth to clean them. If the adjacent tooth surfaces are not cleaned, the dental plaque that is adhered to the surfaces will release toxins, causing the gums in the area to become inflamed, red, swollen, and bleed easily, resulting in gum disease. Therefore, apart from daily toothbrushing, you need to floss every day to clean the adjacent tooth surfaces in order to prevent gum disease. Flossing methods. Finger wrap. In the finger wrap method, you need to use a piece of dental floss of 30 to 45 centimeters long. Wind each end of the floss around the middle fingers. Control a 2 centimeter segment of dental floss with your thumbs and index fingers. To release a clean floss segment, unwind the floss a bit in the same direction. Flossing methods. Floss loop. Use a piece of dental floss of 20 to 25 centimeters long. Put the ends of the floss together. Tie 3 overlapping knots in the same spot. Pull the floss taut to tighten the 3 knots. This way, the floss loop will not loosen up when it is in use. When you floss, the fingers of both hands should pull the floss loop taut. Control a 2 centimeter segment of the floss with your index fingers and thumbs. When you need to change to a clean segment of the floss, simply move the fingers sideways. Flossing tips. Slide the floss in between the teeth. Hold the dental floss with your thumbs and index fingers to start flossing. For finger wrap method, hold the floss taut with the middle fingers. For floss loop method, hold the floss loop taut with the other fingers. When the floss is held taut, gently ease it down past the contact point of the 2 adjacent teeth. Then, slide the floss into the space between the teeth, into the gums, until you cannot go any further. Flossing tips. Clean the adjacent tooth surfaces. When the floss reaches the point of the gums where you can go no further, wrap the floss around one adjacent tooth surface. Wipe the floss up and down to remove the dental plaque. Flossing tips. Clean the other adjacent tooth surface. After having cleaned one adjacent tooth surface, slightly lift the floss towards the crown until you reach the contact point between the 2 adjacent teeth. Then, hold the floss taut against the other adjacent tooth surface. Gently ease it into the gums until you cannot go any further. Then, wrap the floss against the surface and wipe it up and down to remove plaque. After having cleaned both adjacent tooth surfaces of the same gap, ease the floss out gently. Notes for flossing. 2 centimeter tips. To master flossing, use the thumbs and index fingers to control a 2 centimeter segment of the floss. The point is to keep the fingers very close to the teeth being cleaned. The longer the floss, the harder to control. Notes for flossing. Floss carefully. Do not force the floss through the contact point between the adjacent tooth surfaces. This will easily injure the gums. In flossing, remember to wrap the floss around the adjacent tooth surface. Do not keep it straight, but keep the floss curve against the adjacent tooth surface. Otherwise, you may hurt the gums. Notes for flossing. Slide the floss into the gums to the point till you cannot go any further. In flossing, when the floss reaches the point in the gums till you go no further, it looks as if the floss is cutting into the gums. It may look as if the gums are being injured by the floss. Actually, there is a crevice between the gums and the teeth. After the floss has passed the contact point, into the interdental space, it can be slid down against the adjacent tooth surface to reach the crevice, or until it cannot go any further. Although it looks as if the floss is cutting into the gums, as long as the floss is slid down slowly, the gums will not be hurt. On the contrary, if the floss is not slid down to the crevice, the entire adjacent tooth surface is not thoroughly cleaned, and the dental plaque that is left behind in the crevice will cause gum disease. Notes for flossing. Move the floss from one adjacent tooth surface to the neighboring one. After cleaning one adjacent tooth surface, lift the floss slightly away from the gums towards the crown until you reach the contact point between the two adjacent tooth surfaces. Then, move the floss over to the neighboring adjacent tooth surface to clean. Notes for flossing. Two adjacent tooth surfaces of the same gap. An interdental space is formed by the adjacent surfaces of two neighboring teeth. After cleaning the dental plaque of one adjacent tooth surface, make sure that the neighboring adjacent tooth surface is also cleaned before the floss is eased out of the interdental space, so that no surface is omitted. Notes for flossing. Cleaning front teeth and back teeth. When cleaning the front teeth, the finger of one hand should be placed in the mouth, and the finger of the other hand should be placed outside the mouth to control the floss. When cleaning the adjacent tooth surfaces of the molars at the back, the fingers of both hands controlling the floss should be put inside the mouth, and they should stay close to the tooth being cleaned. Notes for flossing. Cause of gum bleeding. When gums bleed on flossing, it is most likely due to not having flossed the adjacent tooth surfaces for a long time. The dental plaque accumulate on these surfaces, causing inflammation of the gums there. The inflamed gums are being touched by the floss. The gums bleed easily. Therefore, the adjacent tooth surfaces should be cleaned thoroughly to remove the dental plaque. The gums will not bleed anymore. Notes for flossing. Learning to floss. If you are not skillful in flossing, you can start with the lower front teeth. When you have mastered the technique, try on the upper front teeth, then the lower molars, and lastly, the upper molars. It is difficult to master the skill of flossing all the adjacent tooth surfaces. It is not necessary to learn to clean all the adjacent surfaces at once. Practice flossing on 1 to 2 adjacent tooth surfaces in the beginning. When you have mastered the technique, move on to the other adjacent tooth surfaces until you have managed the skill on every adjacent tooth surface. Then, you should clean them orderly from one side to the other, and on both the upper and lower teeth. Do not omit any. Use of an interdental brush. The interdental brush is used to remove the dental plaque, which has adhered to the adjacent tooth surfaces of the teeth. There are different sizes and shapes of interdental brush heads to fit different sizes of interdental spaces. To choose an appropriate interdental brush, the brush head should pass through the interdental space easily, but should not be too loose. It should not be forced through the interdental space, nor be too large that it gets stuck in the interdental space. This interdental brush is appropriate for this particular interdental space. Should you have different sizes of interdental spaces in your mouth, different sizes of interdental brushes should be chosen. Place the appropriate interdental brush at the gums and insert it through the interdental space gently. Move it in and out 2 to 3 times. When done, Slide it out gently without using any force, lest the gums are injured. After every session, the interdental brush should be cleaned, dried, and kept for use next time. The interdental brush should be replaced if the bristles are frayed out.